Thanks so much. Appreciate the opportunity to speak. My name is Jacob Pendergrast. I am a physician working at the University Health Network, where I serve as a clinical hematologist and the medical director of the blood bank. I'd like to discuss the public health consequences of these bike lanes. I think it was demonstrated clearly from the before and after study that the installation of the protected bike lanes dramatically increased the number of cyclists. There was no assessment of the public health effects of this project. Aside, I'll remind you from noting that there was no impact on transit time by ambulances or other emergency services. I would like to emphasize the salutary effects of increased transportation, active transportation on the medical system. This has been demonstrated by numerous other studies. There are clear benefits, obviously, to the cyclists themselves as a result of increased physical activity, benefits that have been shown to outweigh the increased exposure to emissions from the cars around them. But as other studies have also shown, even a small shift from car-based to active transportation, a shift which the installation of protected bike lanes clearly facilitates, dramatically reduces emissions to everyone's benefit. A study from New Zealand, for example, found that if the proportion of trips less than 7 kilometers in an urban setting taken by bike increased just from 1% to 5%, the resulting reduction in traffic pollution would result in measurable reductions in population rates of acute respiratory and cardiac events in adults, as well as cancer diagnoses. In fact, for every 1,000 individuals in the 20 to 64 age range who take up cycling as their usual means of commuting, overall population mortality decreases by 17.5%. The benefits of decreased air pollution are even more dramatic in children. In a birth cohort study, every interquartile range increase in traffic-related air pollution is associated with a 30% increase in the diagnosis of asthma, a 20% increase in ear, nose, and throat infections in the first 4 years of life. Prenatal and postnatal exposure to various air pollutants has been associated with reduced cognition, attention problems, ADHD, and autistic traits. Pooled estimates from a meta-analysis estimated a 12% greater risk of preterm birth per 10 microgram increase in particulate matter per cubic millimeter of ambient air. Even setting aside the well-established financial benefits of bike lanes to the businesses that they run beside, the public health benefits of shifting away from vehicular traffic and towards active transportation are worth many millions of dollars. That same study from New Zealand estimated that even setting aside the costs of vehicular collisions, every 1,000 kilometers driven by cars incurs $25 in healthcare costs. So I'd like to emphasize that there are public health ramifications from decisions that encourage people to continue driving and discourage the use of bikes. And I would therefore argue strongly in favor of keeping these bike lanes, which have been shown to be very effective at increasing bicycle use. Thank you.
Thank you. Are there questions of the deputant? Okay, seeing none, thank you. We'll go online to Mary.